Hi guys, welcome to my channel. This is Dr. K and this is the Gynae Talks. We talk everything reproductive health, anything and anything about your reproductive health, whether you're a woman, whether you're a guy. We talk about literally everything reproductive. So welcome to this channel. I hope you have subscribed. Hit that button right there. Like, share to your friends, and make sure to comment down below on the topics that we discuss. So today I'm gonna talk about something that we really don't like talking about, but we still have to talk about it because it affects everyone as long as you're sexually active. And I will ask you a question. If you're sexually active, have you had an STI scare? Well, let's find out. Let's check what you really need to know about this. Let's talk about sexually transmitted infections. And this time we want to talk about the ones you don't know whether you have, or maybe you've ever had them before, or you know someone who had them, or you know someone who knows someone who had an STI. So well, this is not something to be worried about or be scared to talk about, because it is very important and it affects anybody. As long as you're sexually active, you are at risk of getting an STI. Well, of course, unless you're using a barrier method, which is a condom, which protects you from most STIs, and I really recommend it if you are sexually active and you're not in a committed relationship. You need to be using a barrier method. Oh well, let's go straight to the STIs, and we need to know whether you are at risk of getting an STI, or whether you've ever had an STI, or you just don't know whether you do have it. So let's find out what this means. So an STI is means sexually transmitted infection. If you see STD, it means sexually transmitted disease, and there's so many, but I want to concentrate on the ones that are more common and the ones that are silent, and especially the ones that are silent, because the ones that come out as a symptom, at least they come out as a symptom, so you go to the hospital and you're treated. But the ones that are silent, you don't know whether you have it, and then it has diverse effects later on in life. And I really don't want you to have it, especially if you're on this channel. You are not gonna have them, because you're gonna find out if at all you're at risk in the first place. So who's at risk of getting an STI? One, anybody who's having sexual intercourse. Anybody who's having sexual intercourse, you're at risk of getting an STI. If you have multiple partners, it means the one you had yesterday, the one you're gonna have tomorrow, they're probably gonna have different bugs, so you don't know. So if you're having multiple sexual partners, you're most likely to get an STI. 3, if you have a partner who has had a history of STI, you could be at risk of getting the STI as well. Number 4, if you are if your work entails a lot of interaction with different people of a sexual nature, then you're likely to have be at high risk of getting an STI. Like if you are a commercial sex worker, or if you are an MSM is males who have sex with men, or if you engage in high sexual activity with different people, that puts you at high risk. Another thing is if you are already immunocompromised, that means your immunity is low. For example, if you already have HIV, which on its own is an STI as well. It's mostly an STI, by the way. You can get it in other ways, but if you're HIV positive, then you're more likely to get an STI. If you have other vaginal problems or any infections, they predispose you to getting STIs very fast. So these are the people who are more likely to get STIs. So you have to be very careful. Either use a barrier method, or, by the way, abstinence is very good and commendable. If you can do that, then do it. Avoid it at all costs until you're ready, or you're in a committed relationship, either marriage, or for sure this is the person you're gonna be with for a long time. How to prevent it is what I have discussed, but another way to prevent getting an STI is doing the STI screening with your partner just before you get into a sexual relationship. STI screening cannot be emphasized anymore. Like, it's one of those important things that you really need to do as a person. Take it upon yourself to just do an STI screen if you decide you're gonna be with someone, just because you can't tell whether they have an STI or not. Sometimes they might have had it earlier. There are those ones that can appear and then disappear and then reappear. So you just don't know who has it and who doesn't have it. So it's important to actually have the whole screening done for you and your partner together. When you're doing it together, even better. So I'm gonna talk about the common ones that actually appear. Then I want to concentrate on the ones that you really don't know that you have, if you really do have them. So the common ones that actually show symptoms are things like herpes. Herpes usually has symptoms, and it's usually small, multiple, like wounds that can occur down below either your vagina or the penile area. So they're very painful, and they're multiple. So that is one that will show. The only thing is that with herpes, it will be treated and then it disappears and then it reappears. Whenever your immunity goes down, it reappears, you know. So that is something that you might not know that your partner has, but now you go ahead and have sexual intercourse, then you get it, and then you end up having to blame each other, you know. So you don't want to have that situation. You can actually test whether someone has herpes, and that herpes is type 2. There's that one that we call herpes type 1, which is not usually sexually transmitted, and it's like the one you see with people having a cold sore. That's a type of herpes, but that's not the one we're talking about. We're talking about the one down below, and that's herpes type 2, which must be tested. Another STI that usually has symptoms is syphilis. Syphilis has, you get a wound, but that wound is usually not painful. We call, you know, it's not painful, so it can occur. You can see it mostly in men, but in the women, when it's hidden right inside your vagina, you might not know that you actually had it because it's completely painless. So syphilis can be noted in men mostly, and less likely in women. So it's also important to test it, because you know why? Syphilis can cause a lot of diverse effects, especially if not treated early. It can cause pregnancy loss. It can cause you to have a problem with your brain, you know, like it just goes everywhere, even your heart later on if not treated. In fact, it goes in stages. So syphilis is very dangerous if not treated early, but the beauty is that it's actually very treatable. So that's another thing that has symptoms, and at least you can be able to tell it in a male but not in females. Another one that's usually very common that we see it actually in the younger generation is called the chancroid. The chancroid is just like the one for syphilis, but this sore, it's one sore, just kidonda moja, but it's very painful, and it might be associated with lymph nodes around your just in between your legs, you know, the lymph nodes around that area, they might enlarge and they're very painful. So chancroid is very common in the younger population. Sometimes we don't know why, but I think also the sexual activities have increased, but it's something that can be treated, and at least it has symptoms. So that one can be treated, and you cannot avoid it, as in if it's there, you will know it's there. So the chancroid is also another one. Those are the ones that actually have symptoms that are very clear. I'll talk about bacterial vaginosis shortly, because I'll have a whole video on bacterial vaginosis, because it's a spectrum of changes in your vagina. But why sometimes we put it in the group of sexually transmitted infections is because if you've not been sexually active, then bacterial vaginosis is less likely to happen. But after you've been sexually active, then you tend to have like more likelihood of changes in your pH. And this is why, if you have a partner who has, you know, when you're with a partner, they usually produce semen, and semen is alkaline. Your vagina is acidic, So when you have alkaline going into the vagina, which becomes less acidic, because the vagina was acidic, now when you put the two together, it reduces the acidity of your vagina. And what happens? It becomes a bit more alkaline, and that's when you get an imbalance in your bacteria inside your vagina. So that is when you get bacterial vaginosis, and the symptom is really false smelling discharge, really bad. I've discussed it in my other video of discharges, vaginal discharge, so make sure you check that video. At least it will give you an idea on what vaginal discharge could tell you, what it means, and which one is an STI. So bacterial vaginosis might also be put as an STI. So I'll go to now the ones that really don't have any symptoms, but the symptoms may occur later on in life, and that's not very good to have because you wish you could have discovered it very early. So I'll start with the first and the most common ones, and that is chlamydia and gonorrhea. Less is known about chlamydia, but gonorrhea, many people know about gonorrhea because it gives you pussy discharge in men. But in women, when you have discharge all the time, you don't know which one is purulent, like it's producing pus. So it might confuse you and you might not be able to get what it is exactly. So gonorrhea has been widely spoken about, but chlamydia, not very many people really discuss it because there's no symptoms when it comes to chlamydia, and most of the time even gonorrhea. So the two of them go hand in hand, and what they do is that when they're inside there, they go and infect your cervix. Then you get something called cervicitis, now inflammation of your cervix, and then it can go up, and then infect your tubes. And what happens when your tubes heal? Because sometimes, when it's not treated, they will heal on their own. The body has a way to heal itself. When the tubes are not treated, then they will block. And that's why we get so many people with blocked tubes. And that could be one of the reasons. There are many other reasons that can cause blocked tubes, but one of the most common reasons is these kinds of STIs, chlamydia and gonorrhea, which ascend and go up to your tubes. So these are very silent organisms that you don't know you have, but you only discover when you're having a problem with fertility, and can also affect the men as well. So you have their tubes blocked as well, and they cannot father children. So that's one of the few that you really need to investigate, and you need to see a gynecologist to make sure that they can be able to tell what's going on. So chlamydia and gonorrhea, you don't know when it's there. And then you have HIV. HIV is also very common as well, but not very many people will come and say, okay, fine, I have this. You won't know who has it. The HIV doesn't have a face to it, so you might not be able to tell when someone has it. So it's important to test for that HIV, because the symptoms that occur, when they occur, you already have AIDS. So you don't want to get those symptoms. And even some of the symptoms of HIV or AIDS could be because you're having now other STIs. Now you have those symptoms of the first STIs I talked about. Now the chancroid, the one I talked about, they kind of like take opportunity when your immunity is low, and then now you get those symptoms. So by the time you're getting that with HIV, it means that the HIV has been there for a while and you just didn't know. Another one without symptoms is hepatitis. I'm telling you, hepatitis is even more infectious as compared to HIV, and very many people don't know that. You can get hepatitis through kissing. You can't get, very rarely will you get HIV through kissing. But hepatitis, my goodness, any bodily fluids, you can get hepatitis B and C. The two of them are sexually transmitted most of the time. But you remember I said it can be transmitted through other fluids. So if you touch blood that has hepatitis B or C, you can get it. If you do, maybe like if you're a doctor like me and you tend to maybe prick yourself, you can easily get these things. So hepatitis B will also take some time before it manifests, but when it does, it can lead to things like liver cancer, and that's not good as well. So those are the important ones. There's one more I really want to talk about, and this is the HPV. we've talked about cervical cancer, and HPV is the virus that causes cervical cancer. HPV can be detected early enough so that we can be able to investigate and find out whether there are changes in your cervix. But if you don't do pap smears, the pap smear is a test that you do to find out whether someone has changes in the cervix. Or if you haven't done the viral test for the HPV, then it means you're doing yourself a lot of disservice. You don't know what's happening or what will happen later on in life. It can take even up to 20 years before the HPV manifests itself as cervical cancer. So this is another silent STI that many people don't know about, and I implore you guys, you can be tested for these things. You can be tested for, there's so many others that I've not discussed, but I really want you to consider the quiet ones: the chlamydia, gonorrhea, the HPV, HIV, hepatitis. They are completely silent the first few weeks, months, years, but later on the effects are dire. Syphilis is in between because it can present as a symptom, but mostly in men. But later on in life, like in women who don't know that they have syphilis, then it will cause problems in your heart, your lungs, literally everywhere. So please write down in the comments below if you feel like this information has really helped you. Share it with your friends, because we talk about STI screening, but not very many people do it. So you just go into the next relationship and the next relationship and the next, and you just don't know who had what, and later on in life you realize you have problems. So make sure you do your STI screening, get yourself tested, get treated early, and then prevent things like infertility, brain damage, heart damage, other organ damage from HIV and hepatitis. This is very, very important. So from Dr. K, and this is Gynae Talks. Make sure you share this. Personally, I wish I could share it everywhere, because I have this conversation with almost every patient I have. The condom is a lifesaver. Please use it. And if you are abstinent, remain abstinent until when you're ready. And if you are in a relationship, make sure it's a committed relationship, and be open about these infections. You might save your partner, and you never know, your partner, if they love you for real, they will stay with you and go through it with you. So I'll see you soon.